Okay. So today we will learn basics of medical coding. Okay. So in basics of medical coding, first, what are the books used in medical coding? Okay. So what are the books used in medical coding? So basically we are used four books in medical coding. Okay. So we are used four books in medical coding. Okay. So the first one is ICD 10CM. Okay. So the full form of ICD 10CM is ICD means International Classification of Diseases. 10 means 10th revision. CM means clinical modification. Okay. So this is the full form of ICD 10CM. Okay. So must and should you can remember this abbreviation. Okay, what is the full form of ICD 10CM? Okay, so the ICD means International Classification of Diseases. 10 means 10th revision. CM means clinical modification. Okay, so the ICD 10CM is completely diagnosis coding. Okay, so the diagnosis like fever, asthma, headache, something. Okay, so these are all the diagnoses. Okay, so these are all codes under ICD 10CM. Okay, the ICD 10 PCS. Okay, so what is full form of ICD 10 PCS? So the second book is ICD 10 PCS. What is the full form of ICD 10 PCS? Okay, so the ICD means International Classification of Disease. So that is common. Okay, so the 10 means 10th revision. PCS means Procedural Classification System. Okay, so this ICD 10 PCS coding is completely procedure codes. Okay, so completely for procedure coding. So the procedures like appendectomy, tonsillectomy, okay, some biopsies, okay, some repairs, okay, bypass procedures, something. Okay, so these are all under ICD 10 PCS. Okay, so the ICD 10 PCS is completely procedure coding system. Okay, the next book is CPT. Okay, what is the full form of CPT means? Current procedural terminology. Okay, so the CPT coding also completely for procedure coding. Okay, so the CPT also completely for procedure coding. Okay, so what is the difference between ICD 10 PCS versus CPT? Okay, so basically the CPT also procedure coding and ICD 10 also procedure coding. Okay, so what is the basic difference between CPT versus ICD 10 PCS? Okay, basically these CPT procedure codes are only used in outpatient settings. Okay, for example, the patient comes to the hospital, so on the same day, so the physician performed any surgery, okay, or any treatment, so that time we can assign CPT procedure code. Okay, but so the PCS procedure codes are used in inpatient settings. Okay, so the inpatient means the patient spent at least one midnight stay in the hospital. Okay, so the inpatient means the patient spent at least one midnight stay in the hospital, that is called inpatient. Okay, so the patient spends more days in the hospital. Okay, sometimes 1 day, sometimes 2 days, 10 days, 1 month, or 1 year also. Okay, so the patient spent 1 year also, so in inpatient basis. Okay, in that inpatient hospital, so during the hospital stay, the physician performed any surgical treatment or any medical treatment, so that time we can assign PCS codes. Okay, so the patient so anyone have questions? Some disturbance, I think. Somu, so please mute. Somu, do you have any question?
No, Ji, no questions.
Okay, so please mute yourself. Okay, thank you. Yeah. So the next book is HIPICS. Okay, HIPICS means Healthcare Common Procedural Coding System. Okay, so basically this HIPICS means supplies. Okay, so the HIPICS full form is Healthcare Common Procedural Coding System. Okay, so please listen, guys. Okay, don't write any full forms. Okay, so after once the class is finished, so by end of the class, so definitely I will share this PPT. Okay, in WhatsApp group. Okay, so HIPICS means Healthcare Common Procedural Coding System. So, what is mean by HIPICS? Okay, so this Healthcare Common Procedure Coding System, this is for supplies. Okay, supplies means at the time of surgery. Okay, so at the time of surgery or at the time of treatment. Okay, so the physician used any instrumentations like any needles, syringes, okay, or any screws, plates, rods, anchors, wires, stents sometimes, okay, sling. So these are all under supplies, okay. So we assigned supply codes, okay, for the hospital settings, okay, in HIPICS, okay. So in inpatient coding, basically, okay, in inpatient coding, we are learn only two books. One is ICD-10 CM, next one is ICD-10 PCS. Okay, but in outpatient we are used. So we are learn only for two books. One is sorry, three. One is ICD-10 CM. Next one is CPT. Next one is HIPICS. Okay, so that is the difference between outpatient versus inpatient visits. Okay, so basically the payment method. Okay, there are two types of coding. Okay, so basically there are two types of coding. One is outpatient coding, next one is inpatient coding. Okay, so outpatient coding means that is physician based coding. Okay, for the physician reimbursement purpose. Okay, in physician reimbursement purpose, so the outpatient coding we are used three books. One is ICD-10 CM, next one is CPT, next one is HIPICS. But in inpatient, so that is hospital coding. Okay, so one is physician coding, next one is hospital coding. In hospital coding, so we are used only two books. One is ICD-10 CM, next one is ICD-10 PCS only. Okay, so coming to history of ICD-10 CM. Okay, so you know, right, what is the full form of ICD-10 CM? So the ICD means International Classification of Diseases. 10 means 10th revision. CM means clinical modification. Okay, so this ICD-10 CM coding. Okay, so in the United States, clinical modification to the World Health Organization, so International Classification of Diseases 10th revision, ICD was adopted by World Health Organization in 1990. Okay, so basically, so the ICD-10 CM is adopted by World Health Organization. Generally, who are prepared for this ICD-10 CM? Okay, so in ICD-10 CM, each and every condition, one specific diagnosis code, each and every disease, one specific diagnosis code. Okay, for example, I will show you that ICD-10 CM book. Okay, so basically this is ICD-10 CM book. Okay, so see this book. One second. Yeah, see some specific conditions are diseases, some specific codes. Okay, for example, okay, um, bronchitis. See, okay, for example, bronchitis. Okay, bronchitis. So the patient coming to the hospital for bronchitis, so the physician diagnosed this disease, so that time you can assign one specific code. Okay, bronchitis. Okay, so where is that bronchitis code? So This is bronchiolitis,
Sit down,
bronchiectasis.
sit down.
Yeah, yeah.
Next page starting.
So bronchitis. Okay. So in bronchitis, okay, so the code is J40 line. Okay. So this is basically ICD-10 CM book, guys. Okay. So I will tell you so how to search diagnosis codes in this book. Okay. How to search diagnosis codes in this book. So I will tell you. Okay. So in coming slides. Okay. First basics. Okay. History of ICD-10 CM. Basically, the ICD-10 CM is organized by four cooperative bodies in USA. Okay, so the ICD-10 CM is organized by four cooperative bodies in USA. One is AHA, next one is AHIMA. One second. Okay, so the ICD-10 CM is organized by four cooperative bodies in USA. One is AHA, next one is AHIMA, next one is CMS, next one is NCHS. Okay, AHA means American Hospital Association. Okay, so AHA means American Hospital Association. Okay, so AHIMA means American Health Information. American Health Information Management Association. Okay. Next, CMS means Center for Medicare and Medicaid Services. Okay, Center for Medicare and Medicaid Services. So NCHS means National Center for Health Statistics. Okay, so NCHS full form is National Center for Health Statistics. Okay, so basically these four cooperative bodies maintained in ICD-10 CM and ICD-10 PCS and CPT. Okay, so and HIPICS also. Okay, so finally, so not PCS. Okay, not ICD-10 PCS, ICD-10 CM, CPT, and HIPICS. Okay, so these three. Okay, these three is maintained these four cooperative bodies. Okay, so ఈ మూడు మనకి okay, so these four cooperative bodies are maintained in ICD-10 CM, CPT, and HIPICS, but in ICD-10 PCS is maintained by 3M HIS. Okay, so that is different, so I will tell you in detail so when we start ICD-10 PCS coding. Okay, so in coming to ICD-10 CM, okay, so the basics. Okay, finally, these four cooperative bodies under control by WHO. Okay, finally, these four cooperative bodies under control by World Health Organization. Okay, WHO. Okay, so the basics. Okay, so one second. Okay, yeah. Before ICD-10 CM, we are using ICD-9 CM. Okay, generally, the version is changed every 10 years. Okay, so the ICD version is changed every 10 years. Okay, so initially they started ICD-1 CM. So after 10 years, they started ICD-2 CM, ICD-3 CM. So currently we are using ICD-10 CM. Okay, before ICD-10 CM, we are using ICD-9 CM. Okay, so basically the ICD-9 was implemented in 1979, and the intent of ICD coding system it is would be updated every 10 years. So ICD-10 was scheduled for implementation in 1989. Okay, so as per intent, okay, as per policy, so the ICD coding is updated every year, every 10 years. Okay, not every year, every 10 years. Okay, as per schedule, the ICD 10cm schedule is 1989, but the World Health Organization is delayed 1 year. Okay, so the World Health Organization delayed the revision as they need to time improve the new version and eventually adapted in 1990. Okay, so the World Health Organization is delayed 1 year for the implementation of ICD 10cm. So the first modification to ICD 10 was published in 1998. So the Australian nation was first to implement International Classification of Diseases 10th revision. So AM means Australian modification. Okay, so initially the ICD 10 was first started, so Australian. Okay, so that is ICD 10 AM. Okay, so the ICD 10 AM means, ICD means International Classification of Diseases, 10 means 10th revision, AM means Australian modification. Okay, but in 2001 the Canada published the International Classification of Diseases and Related Health Problems, 10th revision. Okay, so that is Canada Association, CA means. Okay, so basically in total world, so almost 120 countries, okay, using for ICD 10 code. Okay, almost 120 countries. Okay, so they are using ICD 10 coding. Okay, so in Australia, so they are called as ICD 10 AM. Okay, that is Australian modification. Okay, so and so in Canada, so they are saying they are using ICD 10 CA. Okay, that is Canada Association. Okay, since 1999, however, the USA, okay, the United States has used ICD 10 for mortality reporting. Okay, so the coding of death certification typically done by the Vital Statistics Office, not the healthcare facility. Okay, so basically, the since 1999, so the United States, okay, not started for ICD 10cm coding, because so they need some death clarification regarding of this healthcare facility. So that's the reason, so the ICD 10 is not implemented, so in initial stage. Okay, implementing in ICD 10cm will maintains data compatibility, so internationally and between mortality and morbidity data in the United States. So the what is mean by mortality and morbidity means, so in death cases, we will review this SOI and ROM. SOI means severity of illness. So ROM means risk of mortality. Okay, so the risk of mortality means why the patient is dead. What is the cause of death? Okay, so that is any risk factors like any cardiac arrest or any brain dead. Okay, so that time, that is their internal policy, that is different, that is not necessary for our coding. Okay, so this is only for history. Okay, so this is not necessary for don't reminder anything. Okay, so this is for history only. But so we will learn, so this one is very important. Okay, so first you can learn code structure. Okay, what is the ICD 10cm code structure? Okay, coming to ICD 10cm code structure. Okay, so the ICD 10 codes consists of minimum 3 characters and maximum of 7 characters. Okay, so coming to code structure, so all ICD 10 codes are, okay, so minimum 3 to 7 characters. Okay, some diseases like I will show you. Okay, for example, hypertension. So the patient comes for the hypertension. So the hypertension diagnosis code is I10. Okay, so the I10, that is only for 3 digits. Okay, so the I10 only for 3 digits. Okay, for example, so the patient from comes from STD, like, okay, so sexual dysfunction. Okay, sorry. Sorry, yes. So some diagnosis. Okay, so 4 characters. Okay, some diagnosis like 5 digits like K70.30, that is alcoholic cirrhosis of liver without ascites. Okay, some conditions pressure ulcer of right ankle stage 1, that is 5 digits. Okay, some of the diseases like 6 characters, someone is 7. Okay, so the minimum 3 to 7 characters. Okay, the ICD-10 CM code structure minimum 3 to 7 characters. The first character always alphabetic letter. Okay, so please remember this point. Okay, so the first point is, okay, so the first character is always alpha letter. See, the hypertension started with I. Okay, so the sexual dysfunction started with F. Okay, so the alcoholic cirrhosis of liver started with K series. Okay, the pressure ulcer of right ankle started with L series. Okay, and corrosion. Okay, so corrosion means like chemical burns. Okay, so the chemical burn is started with T series code. Okay, and maternal. So this is pregnancy related. So maternal conditions, pregnancy complications, O series. Okay, so see the code structure. So the first character of an ICD-10 CM code is always alphabetic letter. Okay. Next, all the letters of the alphabets are utilized with the exception of the U letter. Okay. So this is also very important interview pattern question for freshers. Okay. So in freshers interview pattern, they are asking like, so please tell me the ICD-10 code structure. Okay. Otherwise, so they are asking, so 1 second. Yeah. So they are asking like, so all alphabetic letters are used in ICD-10 except one letter. What is that letter? Okay, that letter is U. Why the U is not used in ICD-10 CM? Okay, so why the U is not used in ICD-10 CM means the U letter is reserved. Okay, so the U letter is reserved by the World Health Organization for the professional assignment of new diseases of uncertain etiology. Okay, so new diseases of uncertain etiology means so they are identified new disease for this year. But so the root cause. Okay, so what is the exact etiology? Etiology means underlying cause. Okay, etiology means underlying cause. Okay, for example, they identified like COVID. Okay, but the COVID underlying cause. Okay, what is the root cause of COVID? Okay, what is the underlying cause of COVID? Okay, so the underlying cause of COVID is not identified in initial stage. So that time the World Health Organization initially given one temporary diagnosis code. Okay, in U series. Okay, after that the next year, so we will they will continue for the U letter in that particular disease. Okay, for example Ebola virus. Okay, but in Ebola, so that is also new diagnosis. Okay, so that time initially, so in ICD-10 there is no specific code in that diagnosis. So that time definitely they will give one U series code. Okay, so that is etiology means. Okay, so in interview pattern, in freshers interview pattern, this is also one of the important interview question. What is mean by etiology? Okay, etiology means underlying cause. For example, the patient comes for abdominal pain. Okay, so the physician evaluate the patient. Okay, what is the cause of abdominal pain? Okay, so they suspect like acute appendicitis. So they ordered CT abdomen. So in CT abdomen, so the acute appendicitis is confirmed. Okay, so that is the etiology for abdominal pain. Okay, that is the etiology for abdominal pain. Okay, so that is etiology. Okay, understand guys what is mean by etiology?
Yes.
You want one more example, so
Yes, sir.
I will tell you one more example. For example, the patient comes for fever, shortness of breath, weakness, these complaints. Okay, so the physician suspected COVID and so they ordered COVID test. So the COVID test result is positive. Okay, so these symptoms, the fever, shortness of breath, weakness. Okay, so the root cause is mainly the etiology is COVID. Okay, understand what is etiology? Etiology means underlying cause. Okay, etiology means underlying cause. And So, and for bacterial agents resistant to antibiotics. Okay. So sometimes, okay. Yeah, sometimes what is mean by bacterial agent resistant to antibiotics? Okay, sometimes the patient using antibiotics for specific infection condition. Okay, that time, so the another infection condition is developed because of this antibiotic drug. Okay, for example, UTI due to ESBL. Okay, so UTI due to urinary tract infection. UTI means urinary tract infection. Okay, so the urinary tract infection due to, okay, so ESBL. Okay, what is full form of ESBL? Anyone know that? ESBL, what is the full form of ESBL? You don't know? Ramesh, Arjun, so మీరు డైలీ కోడ్ చేస్తారు కదా ఇన్ సమ్ టైమ్స్. What is mean by ESBL? UTI due to ESBL. UTI means urinary tract infection. So that time you can give N39.01 specific code is there. So that time you can give that code. So what about that ESBL?
It's a bacteria.
What is that bacteria? Yes, these are all books are integral to in this tool. Okay. For example, okay, so 55 years. Okay. UTI. Okay, so the UTI means urinary tract infection. Simply, so UTI. Okay, so the option is one. Okay, so UTI. Okay, so UTI other are unspecified. Okay, so other are unspecified. Okay, so the bacteria or virus, for example. Okay, the bacteria or virus. So bacteria. So E. coli bacteria, for example. Okay, E. coli. Okay, so the urine culture is positive for E. coli, for example. Okay, so that time. Okay, so do not wish to quote. They are asking like associated drug resistance. Okay, associated drug resistance, yes. Okay, so the drug resistant is ESBL. Okay, extended. Okay, so extended beta lactamase. Okay, extended beta lactamase. So that time you can select that option. See how many codes. So see, this is UTI code. Okay, so so I think maybe I accidentally click another option. So that's the reason this Acinetobacter also is came. So and E. coli. Okay, the UTI due to E. coli. So the E. coli due to ESBL. Okay, so the ESBL means extended. Okay, beta lactamase. Okay, so this is drug resistance. Okay, so that time we can assign one specific Z16.12 diagnosis. For example, one specific drug is given, but so there is no diagnosis code in the ICD-10-CM. So that time they are given one U series. Okay, so that is the role of U. Okay, so what is the role of U in ICD-10-CM means the U letter is reserved by the World Health Organization because of new diseases of uncertain etiology and bacterial agent resistant to antibiotics. Okay, so and coming to second character. Okay, so in ICD-10 code structure, coming to the second character, so the second character is always numeric. Okay, that is 0 to 9. Okay, and so the third character, the third to seventh characters are mixed with alpha with numeric characters, both. Okay, so the first character is always alpha letter, the second character always numeric. So the third one to seventh characters, okay, so alpha with numeric. Okay, there is a decimal place after the first three characters. Okay, so decimal means dot. Okay, so after first three characters, see, so F52 dot 8, K70.30, L89.511. So the point means that is decimal. Okay, so as code structure, okay, as per ICD-10 code structure, okay, so sorry, so after 3 digits, okay, after 3 digits, one decimal point is added. Okay, so they are saying there is a decimal placed after the first three characters. Okay, so the seventh character is considered as an extension. Okay, so the seventh character is extension. Okay, so and one thing, so in code structure, so see, they are given one question. So this, okay. So this is ICD-10 code structure, guys. Okay, coming to chapters. Okay, so how many chapters in ICD-10CM? Okay, this is also one of the basic interview pattern question. Okay, how many chapters in ICD-10CM? Okay, so overall 21 chapters in ICD-10CM. Okay, overall 21 chapters in ICD-10CM. Okay, so they are asking which of the following is the ICD-10CM? So please tell me, as per ICD-10 code structure, so the first character is alpha letter. So the second character is always numeric. So the third to seventh characters always alpha with numeric both. So after 3 digits, okay, so the decimal point is came after 3 letters. Okay, so which one is the correct diagnosis code? Answer A is correct, or B is correct, or C is correct, or D?
D.
D. T81.718.
Yes. Okay. Answer D is the correct, because so as per ICD-10 code structure, after 3 digits, so the decimal point. Okay. So but in option A there is no decimal point. But in after so in option B, after 4 characters, so the decimal point added. So that is wrong. Okay. So in U series. Currently in U series only 3 to 4 codes are available in ICD-10. Okay, but in U71 there is no specific U series code in ICD-10 same. Okay, so that's the reason. So the answer D is correct, because so the answer D, the first character alpha letter, that is T. So the second character numeric, that is 8. So the third to seventh characters alpha with numeric. Okay, and after 3 digits, so the decimal point also is added. Okay, in the option D. So that's the reason. So the answer D is the correct. Okay, next. So the ICD 10 cm is divided into two volumes. Okay, the ICD 10 cm is divided into two volumes, volume 1 and volume 2. Okay, so the ICD 10 cm is divided into two volumes, volume 1 and volume 2. So the volume 1 is tabular list. Okay, in freshers. So please remember this point also. Okay, so see, in second slide, so in volume 1 and volume 2. So the volume 1 is tabular list, volume 2 is alphabetic index. Okay, I will show you. So what is volume 1 and volume 2 in ICD-10 book? So where is the ICD-10 book? I think it's closed. So this is okay in A letter, B letter. So this is alphabetic index. So this alphabetic index is similar to English dictionary. Okay, this alphabetic index. So this is volume 2, guys. Okay, initially in the ICD 10 cm. Okay, so they are given volume 2 initially. Okay, so after that, so you can see volume 1. So after almost to see after Z series completed. Okay, after Z series is completed. So yeah, so in A series, the course started with A series. So this is so tabular list. Okay, so this is tabular list. Okay, so the volume 1 is okay tabular list, volume 2 is alphabetic index. Okay, so please remember this point. This is very, very important. Okay, so how many volumes in ICD 10 cm is? There are two volumes in ICD 10 cm. The volume 1 is tabular list. Okay, so the volume 2 is alphabetic index. Okay, so what is the use of alphabetic index and what is the use of tabular list? So we will discuss in next slides. Okay, so this is not necessary, guys. Okay, so coming to ICD-10-CM convention. So this is one of the most important topic in ICD-10-CM. Okay, so you have any experience in coding? Okay, you have any experience in medical coding? So in interview pattern, so they are asking some basic questions in this chapter. Okay, in ICD-10-CM conventions chapter. Okay, so this is very important. So you must and should remember some conventions. Okay, in interview pattern, they're asking these conventions on regular basis. Okay, you have 10 years experience or you have 15 years experience. So your designation is QA or TL or so some other designations also. So they are asking these basic questions. Okay, so the first one, so the ICD-10-CM conventions. The ICD-10-CM follows certain conventions in order to provide large amount of information in sustained and consistent manner. A through understanding of these conventions is fundamentals to accurate coding. Okay, so the ICD-10-CM conventions. Okay, these conventions is mainly useful in accurate coding. Okay, so you are assigned exact code and you are assigned sequencing. Okay, so that time must and should you follow these conventions. Okay, so the conventions is given some instructions. Okay, like so the ICD-10-CM conventions include the following. What are the ICD-10-CM conventions means? Okay, so these are all the following conventions. One is instructional notes, next one is abbreviations, next one is cross reference notes, next punctuation marks, next relational terms, and without due to. Okay, so I will tell you one by one. Okay, so don't remember these slides. Okay, so I will tell you one by one. So I will tell you, so what should you remember in must and should in interview pattern. So please remember that point carefully. Okay, so please listen that point carefully. Okay, so in instructional notes, okay, a variety of notes appears as instructions to the coder. These include general notes, inclusion notes, exclusion notes, code first, use additional code also. Okay, so I will tell you general note. What is mean by general note? What is the use of general note in medical? Okay, so I will show you in general note means. Okay, so general note means, see, in ICD-10. Okay, so my God, this is not uploaded here.
Then I'll do it. Then honestly,
Yeah, in general note, I will show you one example. Okay, so
you know, you know, we didn't.
yeah, see, in this book notes. Okay, one notes option is here. Okay, in notes they are saying codes from this chapter are for use only on maternal record, never on newborn record. Okay, in general notes, so they are given one instruction. What is that instruction? Codes from this chapter. Okay, from this chapter means this pregnancy, the chapter 15. Okay, so the chapter 15 in ICD-10-CM is pregnancy, childbirth, and the parturium. Okay, so in pregnancy, childbirth, and parturium, the code range is O002 O9A series. Okay, so in O002 O9A series, so they are given some general note instruction. So they instructed codes from this chapter. So the chapter means this O series codes. Okay, these O series codes are only used on maternal record, never on newborn record. Okay, newborn. Okay, newborn means, so what is the age period for neonate or newborn? Anyone know that? What is the age period for neonate or newborn?
0 to 20.
0 to
28
20.
days.
0 to 28 days. Okay, so in 0 to 28 days, so the baby admitted to the hospital, and so the physician diagnosed some disease. Okay, so that time you do not assign O series codes. Okay, that time you can give, so the newborn once P series code is there, so that time you can use that P series code only. Okay, so they are saying these O series codes are only used in mother record. Okay, so not in newborn record. Okay, understand what is mean by general note means? Like one example. ఓకే జనరల్ నోట్ లో ఇక్కడ ఇచ్చింది ఏంటి ఎగ్జాంపుల్ అంటే ఈ చాప్టర్ 15 సిరీస్ కోడ్స్ అనేవి ఓన్లీ మదర్ రికార్డ్ లోనే కోడ్ చేయాలి అంటే ఇన్ ఇన్పేషెంట్ ఓకే ఇన్ ఇన్పేషెంట్ మోస్ట్ ఆఫ్ ది డెలివరీస్ ఓకే మోస్ట్ ఆఫ్ ది డెలివరీస్ ఆర్ అండర్ అడ్మిట్ ఓన్లీ ఓకే డ్యూరింగ్ ద హాస్పిటల్ స్టే ఓన్లీ okay so that is inpatient admission okay so at the time of delivery so the patient had any problems okay any complications related to pregnancy that time you can assign one O series code. Okay, so these O series codes only used on maternal record. Okay, mother chart only. Okay, do not assign these O series codes from baby. ఓకే ఈ కోడ్స్ అనేవి మనం బేబీ చార్ట్ లో కోడ్ చేయకూడదు అని చెప్తున్నాడు ఇప్పుడు మదర్ కి ఒక చార్ట్ ఉంటుంది బేబీకి ఒక చార్ట్ నెంబర్ ఉంటుంది ఓకే అండర్స్టాండ్ గైస్
Yes.
Yes, sir.
okay so that is general note okay so basically these instructions learning so in initial stage only okay so after you have some experience so that time so these are all not mandatory but these are all the basics first you can learn the basics okay you have strong the basic knowledge so definitely you can learn ICD-10 coding very easy okay so inclusion notes. Okay, so general note. A general note in the tablet list provides general information on use of a specific section. Example, a note under chapter 15 of ICD-10-CM pregnancy, childbirth and the portorium. So that explain the codes from this chapter are used only in the maternal record, never on newborn record. Okay, so that is general note. Inclusion. Okay, inclusion note means I will show you what is mean by inclusion notes. Okay, inclusion note means yeah for example we will search anemia diagnosis code okay sure. Yes, please. Yeah. For example, we will search iron deficiency anemia code. Okay, iron deficiency anemia. Okay, 1 second. So, how to lead this iron deficiency anemia diagnosis? What is the main term? Iron deficiency anemia. What is the main term?
Anemia.
Anemia.
Anemia is the main term. Okay, so go first anemia. Okay, so anemia. Okay, so in anemia. Okay, so in anemia, iron deficiency. Okay, so please enter comma here. Okay, and iron deficiency. Okay, iron deficiency. That the code is D50.9. Okay, see the tablet list. Okay, so this side. Okay, this is alphabetic index in left side. So the right side window is tablet list. So the tablet list D50.9 you can see for D50 series. In D50 series includes, okay, one include notes is there. So the include notes states acidotic anemia, hypochromic anemia. Okay, so these are all the synonyms for iron deficiency anemia. Okay, so you search acidotic anemia, that code also leads to D50.9. Okay, you can search hypochromic anemia, that one also leads to D50.9. Okay, so the includes note means synonyms. Synonyms means alternate words. Okay, అంటే మనకి ఐరన్ డెఫిషియన్సీ ఎనీమియా అన్న D50.9 హైపోక్రోమిక్ ఎనీమియా అన్న D50.9 ఎసిడెరోటిక్ ఎనీమియా అన్న కూడా సేమ్ కోడ్ వస్తుందని దాని మీన్ ఓకే లైక్ ఐ విల్ షో యూ ఓకే సో ఎనీమియా ఓకే ఎసిడెరోటిక్ ASIDE okay acidotic C the code is D50.9 okay the anemia acidotic the code is D50.9 okay so and anemia hypochronic okay so the hypochronic anemia that code also D50.9 okay so that is inclusion notes guys okay understand what is mean by includes Inclusion notes ante అర్థమైందా?
Yes, sir.
Yes, sir.
Inclusion notes are introduced by the word includes when placed at the beginning of a chapter or section. Inclusion notes are used to further define or give examples of the content of the chapter, section, or category. So, example like, okay, so they are given some examples. Okay. So next, so this is very important in intro pattern. Okay, so please remember this exclusions. Okay, so in exclusion notes there are two types of exclusion notes: exclude one and exclude two. Okay, so they are asking what is exclude one and what is exclude. Okay, so the exclude one, okay, simply the exclude one means, okay, not coded here. Okay, so the exclude one means not coded here. Okay, not coded here means like, so congenital hydrocephalus, the code is Q03. Okay, for example, go to hydrocephalus. Okay, hydrocephalus congenital. Okay, so the code is Q03.9. Okay, in Q03, okay, so exclude one. Okay, exclude one. Arnold Chiari syndrome type 2, acquired hydrocephalus, hydrocephalus due to congenital toxoplasmosis, hydrocephalus with spina bifida. Okay, so along with congenital hydrocephalus, so the physician documented, so any acquired hydrocephalus or hydrocephalus due to congenital toxoplasmosis or hydrocephalus with spina bifida. So that time you can code only for congenital hydrocephalus. Okay, do not code. So these conditions along with, so Q03.9 series. Okay, అంటే ఈ congenital hydrocephalus, congenital means by birth. Okay, పేషెంట్ పుట్టినప్పటి నుంచి కూడా ఈ హైడ్రోసిఫిలస్ అనే ప్రాబ్లం ఉంది. ఓకే, సో ద పేషెంట్ సఫరింగ్ ఫ్రమ్ బై బర్త్ this problem, so that is called congenital. Okay, for example, the patient comes for the hydrocephalus for congenital period, so that time we can assign Q series. Okay, but the physician documented both congenital and acquired hydrocephalus. Okay, so the physician diagnosed both conditions like congenital and hydrocephalus, congenital hydrocephalus and acquired hydrocephalus. Okay, so that time you can code only for congenital hydrocephalus, because so the acquired hydrocephalus is under exclude one note only. So that's the reason we can assign only congenital hydrocephalus. Okay, they're asking one example also. Okay, give me any example for exclude one note. Okay, so that time you can simply saying like this example. Okay, so the physician stated like congenital hydrocephalus and acquired hydrocephalus, both conditions are documented. We can code only for congenital hydrocephalus because so under exclude one note it is stated acquired hydrocephalus. So that's the reason I can assign only congenital hydrocephalus. Okay, అర్థమైందండి? ఎక్స్క్లూడ్ వన్ మీన్స్ నాట్ కోడెడ్ హియర్. ఓకే, అంటే ఆ టూ కండిషన్స్ ని ఒకేసారి మనం కోడ్ చేయకూడదు. ఓకే, సో వి డు నాట్ కోడ్ బోత్ కండిషన్స్ ఆన్ సేమ్ విజిట్. ఓకే, సో ఇప్పుడు పేషెంట్ కి ఫిజిషియన్ మనకి రెండు చెప్తున్నాడు. సో ద ఫిజిషియన్ స్టేటెడ్ బోత్ కండిషన్స్, acquired hydrocephalus and congenital hydrocephalus. Okay, but you can assign only congenital hydrocephalus because the acquired hydrocephalus is under exclude one means. Okay, so that's the reason we can assign congenital hydrocephalus. Okay, clear? అర్థమైందండి?
Yes, sir.
Yes.
Okay, so the next one, okay, exclude two. Okay, exclude two means not included here. Okay, exclude two means not included here, not included here. So that time you can assign both conditions separately. Okay, so the quite opposite to exclude one and one. Okay, for example, attention deficit hyperactivity disorder, simply ADHD. Okay, in medical terminology sometimes the physician documented like shortcut like simply ADHD. Okay, so the ADHD means attention deficit hyperactivity disorder. Okay, so in exclude 2, anxiety disorder and mood disorder is also documented. Okay, for example, so the patient comes for altered mental status. So the physician final impression, it is documented attention deficit hyperactivity disorder and anxiety disorder, both conditions. Okay, that time you can code both conditions separately because so that is the anxiety disorder is under exclude two notes. Okay, the exclude two notes means you can code both conditions separately. Okay. So understand what is different between exclude one versus exclude two.
Yeah.
Okay. So the next, okay, రేపు నేను అడిగేటప్పుడు ఖచ్చితంగా చెప్పాలి. Okay, so tomorrow definitely I will ask some questions. Okay, what is ICD-10 CM? What are the books used in ICD? Sorry, in medical coding. So next, what are the four cooperative bodies maintained in ICD-10 CM? Okay, and so what is full form of ICD-10 PCS, CPT, and HIPICS? Okay, so and so what is the ICD-10 CM code structure? Okay, and so next one, conventions. In conventions, you can remember this one. Okay, exclude one versus exclude two. Okay, exclude one. What is mean by exclude one means not coded here. Okay, give me one example means so congenital hydrocephalus and acquired hydrocephalus, both conditions are documented. Code only for congenital hydrocephalus. Okay, in exclude two, so attention deficit hyperactivity disorder, simply ADHD. ADHD and anxiety disorder, both conditions are documented. We can code both conditions separately. Okay, exclude two means not included here. Okay, so some other examples, inclusion notes and exclude one and exclude two. Okay, so they are given like chronic rheumatic pericarditis. Okay, so are unspecified chronic bronchitis, chronic tracheitis, chronic tracheobronchitis. Okay, so these are all inclusion notes. Inclusion notes means synonyms. Synonym means similar conditions, similar names. Okay, so if chronic bronchitis kana, chronic tracheitis anna, chronic tracheobronchitis anna, so the same code J42 category. Okay, so in exclude one C, chronic rheumatoid chronic rheumatic pericarditis. So in exclude one, chronic pericarditis not specified as rheumatic. Okay, so this is one more example for exclude one. So in exclude two, so they are given one more example, portal vein thrombosis. So in exclude two, hepatic vein thrombosis. Okay, so these are some additional examples regarding inclusions, exclude one and exclude. Okay. Next, code first and use additional code. So we will discuss so these conventions in tomorrow. Okay, so we will discuss these conventions chapter. So in tomorrow, so tomorrow we will start chapter specific coding guidelines also. Okay, in infections and parasitic diseases. So tomorrow we will complete HIV/AIDS guidelines. Okay, once we complete these conventions, so tomorrow we will start chapter specific coding guidelines. Okay, so tomorrow onwards, so the coding is the ICD-10 CM coding is very interested. Okay, so these are all the basics. So I know some it is some boring chapter, so I know. Okay, but you can concentrate. Okay, so because these are all the basics, so you learn basics first. Okay, so after that only, so we will learn chapter specific guide. Okay. Any questions?
No, sir.
How is the today's section? It is good or average or bad. So what is your opinion, guys?
Very good.
Good, sir.
It's good, sir. It's very useful.
Okay, so today I will share class recording and this PPT also. Okay, so please prepare. Okay, some questions. So I'm asking some questions in tomorrow class. Okay.
Okay, sir.
So